Medicine has a patient dependency problem, and the sad truth is that the system actually runs better whenever you don't fully understand what's going on with your health. This is how the system was designed years ago. Incentives have kept it that way over time. And unfortunately, that's why we're stuck with 15-minute doctor's appointments, prescriptions written, follow ups made, but no true understanding or comprehension of what's going on with your health. Now, for years, you couldn't do anything to fight back against that, but now there are tools available, and that's what we're going to talk about today. My name's Dr. Nolan Fisher. This show is called Second Opinions, where doctors tell you what they actually think. And on today's episode, we're going to talk about using the AI tools that are available to make sure you have more effective doctor's appointments, you get your money's and your time's worth with those appointments, and you can better comprehend what's going on with your care. So first, before we get into the AI tools, let's talk about a little bit of the way the system was built, okay? It was paternalistic by design. The theory was that you didn't have enough doctors to provide the care that was needed, so you needed to have efficient care. This meant that patients would come in with problems. They would tell you what's going on. The doctor would say, yep, this is what's going on, write you a prescription and tell you to come back for a follow-up maybe a few weeks later. The idea was to solve the problem, not necessarily to explain to patients fully what is going on to help with patient comprehension. And of course, this is how it was for years and years and years. And the system aligned with this. So the system wanted to see physical results, and that's how doctors would get paid. So the result was a system that's built where doctors get paid per visit, or they get paid by procedure performed rather. Well, the result is you get more visits and you get more procedures, and you don't necessarily get incentivized for comprehension. And the sad truth now is that people don't really understand what's going on with a lot of the problems in their lives. And I think that if you did understand what was going on, you'd have the ability to make some changes yourself to help make sure things didn't get worse. So for years, people would turn to tools like WebMD to try to figure out what's going on with their symptoms. They would go on to forums and they would talk with people who have similar presentation. And a lot of times they would get really bad advice. And that's because you can only give good advice if you know the full picture of what's going on with the patient. And a lot of times that means physical exams, labs, or imaging, or maybe knowing which questions to ask and how to differentiate out problems. The system did not give the people who really needed this comprehension to figure out what's going on with complex problems the time to do that. And these tools, like I said, with WebMD and online forums were good for some people, but really they weren't enough. And that's obviously changed with the advent of AI. Because now with these AI tools available, you have somebody that's willing to listen to you, even though it's a computer, and to explain things very thoroughly and in a way that you can understand. And when it comes to patient explanations that patients were getting, in the past, you would get a handout or maybe an explanation from your doctor, maybe some material explaining what's going on. A lot of times these materials, though, and explanations are done at a 12th grade level or higher, when the average person in America can only read at between a 6th and an 8th grade level. And a lot of people fall below that. So even if they were given the right material or the right explanation, usually by the time they walked out the door, and even within a few days, that was almost completely gone. So I want to tell you about a visit that I had the other day that really changed my mind on how we can use these AI tools in order to have better patient appointments. So it's better for me as a doctor, but it's also better for the patients and for you guys to get a better experience whenever you do go to the doctor. So the other day I saw a guy and he was healthy, really sharp guy. You could tell as soon as you talked to him that he was very intelligent and he was very understanding of his health right off the bat. He was fit. He wasn't taking any medications. He was roughly in his maybe mid 40s. He was an engineer and he was very computer savvy. And when I walked in, he kind of told me that he had used the AI tools, and not to judge him for it, but he had used them to sort of figure out what was going on and he had a working hypothesis. And I said, that's great. Let's hear it. So he told me his symptoms, and he had had some back pain that had been going on for a while, and it was going down his leg. He had had some intermittent bursts where the pain was really, really bad, but those were tended to be short lived. And he would take his ibuprofen or leave, rest for a few days, and they would go away. The result was he was left with some back pain occasionally, and also some numbness and tingling in his left leg going down to his foot. Whenever he would exercise, these symptoms would get a little worse, but not so bad that he felt like he needed to do anything drastic about it. He actually used ChatGPT to run questions off of it to figure out what was going on. And it said it sounded like he could have a lumbar radiculopathy, which is what my diagnosis actually was, and then gave some reasons why that could be happening. So, for example, it said that he could have a disc herniation, he could have spinal stenosis, which are all causes of lumbar radiculopathy. Whenever he said that, I said, that's kind of sounds like what's going on, but let me do my full examination. And the nice part there was I was able to quickly get into like a physical examination that was thorough. And as I was doing it, I was explaining what was going on to him. So I checked for things like sensation and motor strength to see if there was any permanent nerve damage. And his sensation at that time was normal. His strength in his legs was normal. And then I checked his reflexes to see as well if there was any nerve damage, and those were all normal. I had him do a few maneuvers, and one of them, for example, was a straight leg raise maneuver where you basically, if you imagine if you're sitting down, you stick out one of your legs, so you straighten your knee, and then you lean your head and you lean your back forward. This is meant to put tension on the nerve, and if the nerve is getting pinched, it can cause some of the symptoms to show up. Whenever he did that, he didn't really have much in the way of symptoms, so it let me know that the nerve that was getting irritated wasn't getting severely pinched. All of this information together told me that he likely just needed some conservative treatment, maybe some activity modification, but he didn't need anything like surgery or injections because the symptoms just weren't bad enough. And so as I was doing the examination, I was explaining all this. And then he started asking, well, what would be indicated here, right? Should I stop golfing? Should I do some physical therapy? And I talked to him about a home exercise program that he could do on his own first that would strengthen his core muscles to help support his back. I talked to him about loosening up his hips so that way his hips could move better and that way he wasn't putting as much strain on his back. And I talked to him about golf, and he really liked playing golf, and he said he didn't want to give it up, but he also didn't want to make symptoms worse. He didn't want to make his back get worse in the long run so that way he would suffer down the road. And I talked to him about what the research said, and that was that you're better off if you stay active. And if you can play golf and you can manage the symptoms, and maybe you stick to a rigid home exercise program, you loosen up your hips a little bit, and that allows this to sort of go away or stay about the same, then it was completely fine. And then at that point, he was like, well, I thought going into this that I want an MRI, but talking with the AI, it said that an MRI may or may not be indicated. So I really want to know from you, do you think the MRI is useful? And I told him basically that we didn't need to do an MRI. We could if you wanted, but I don't think that it would really change anything right now. And then I personally told him that from my perspective, if it were me, I would probably just go out and get an MRI just to see what's going on, just to make sure we aren't missing anything. And in the future, if things do get worse, then he could have a previous MRI to compare to. And so we talked about that, and eventually we agreed we're going to get him an MRI. And next thing you know, it was 10 or 12 minutes later, we had had this really in-depth discussion. He had a good understanding of what was going on with his problem. He knew exactly what to do to follow up on it. And that was it. 10 minutes later, he'd gotten everything he had wanted. And it was a really useful, valuable appointment where I got to share a lot of really pertinent information to him specifically. And as I was walking out of that appointment, I thought of how starkly this contrasted with some of my other patient visits. And some of the other patient visits I have are where patients have no idea what's going on, and no one's ever explained to them before they see me what could possibly be going on. So we basically had to start from zero, and we had to ask every little question about their pain. We had to ask every little question about their history just to make sure we weren't missing anything. And for these patients during their physical exam, they really didn't have a baseline of knowledge to understand what I was doing with that physical exam and the importance of the maneuvers. And I see this over and over again. And yeah, there are some patients that just want to be treated, right? They just want to come to the doctor. The doctor can tell them what's going on and they can get the treatment. But I think that most of us would like to comprehend what's going on with our body because ultimately that's the most valuable asset we have. And when it comes to a lot of patients, there's just such little understanding before of what's going on and so much difficulty in me understanding the basic concepts of what's going on that by the time I get into the more complex details, it's just an information overload at that visit. And no matter how many handouts we have, they're never as specific to that patient as I would like it to be. And so seeing how we can use these AI tools as a way to prep people, it kind of got me thinking. And I think that the AI tools are not a replacement for doctors. And I don't think necessarily that they're always right. But I think whenever you prompt them the right way, they can make your doctor's appointment much better. So after seeing this, I was talking with some colleagues and some other colleagues that had the same thing happen to them. And it got me thinking that if you have a doctor's appointment, you should probably be using these tools. And if you don't know how to use these tools, they're very simple to use. And I want to go over how we can use these tools, not necessarily to replace your doctor or get medical advice that may not be warranted, but to actually prepare for your doctor's appointment. So, what I'm going to do is I'm going to go to ChatGPT and I'm going to show you what I typed in earlier and how we can then use that in other situations for your doctor's appointments. All right, so let's look at this. First thing you have here is ChatGPT. Now, if you haven't used ChatGPT, you can simply go down to the bottom. There's a text box, and you can just type in whatever you want. Here's how I focused my question, so that way I thought I would get valuable answers. I said, I have a doctor's appointment next week for my back pain. It is with a back pain specialist. What do I need to know going into this appointment? What questions should I make sure to ask? And I thought the results were really good here. You know, it basically said this can make a big difference, what to bring and what to prepare. And this pain history stuff that it talks about here is all so valuable to me. And if you're able to pay attention to this stuff before you come in, and I know this, then this makes it so much easier to make a diagnosis. And I think for pretty much all medical problems, that would be the case. The second thing it says here, what the specialist will likely evaluate. I mean, this gives you an understanding of what to expect going in. So that way, if none of this happens, you know, that may be a red flag that the physician you're seeing isn't doing the right things. And it may not always be right, but this is exactly what I do. So I was pretty interested to see that. Then it said key questions you should ask. And I thought this was probably the most powerful part. It said at the top, don't worry about sounding over prepared, which is funny because I actually, you know, you can kind of tell when people prepare for their doctor's appointments because you see what people usually say. When someone comes through with this knowledge and asks the right questions, it just makes my job, frankly, a lot easier. So, asking about the diagnosis and the cause. What do you think's causing my pain? Is it temporary or chronic? What tests need to be done? What treatment options are available? Activity and lifestyle changes, prognosis, and what red flags. The final part of this is really cool. Things to watch out for. So, in my field with neck and back pain, there are a lot of unnecessary surgeries done every year. And that's because of incentives to do more surgeries. And it says, be cautious if you're pushed immediately towards aggressive treatments like surgery without trying conservative options first, unless there's a clear medical reason. Many back issues improve with time and non invasive care. And then finally, after the appointment, make sure you can leave with a clear plan, specific next steps, and understanding what progress should look like. This is awesome. And this you could do with every single problem. You could swap out, I have a doctor's appointment next week for my, you could swap out back pain with whatever problem. You know, you could say who you're seeing. You could even type in that person's name and you could say, what do I need to know about this appointment? Funny enough, whenever I saw this guy, he actually said whenever he was asking one of the AI, I think it was ChatGPT, he asked which doctor he should see, and the AI actually recommended me and then gave reasons for why it recommended me. So that's it. I mean, that's what I have here. You know, the system has been built paternalistically forever, and you get these 15-minute appointments that can be frustrating. And I honestly don't think, as much as some people like to say, that we're going to completely destroy and flip the system and bring in a new healthcare system anytime soon. So we have to know how to play the game so that we're getting the best value for ourselves out of it. And as patients, I think you're entitled to comprehend what's going on with you. I don't think we need to deal with this. You come in, we fix your problem, you don't know what's going on. I don't think that's I don't think that's the right way to do medicine. And so now that we have these tools available, yeah, they can mislead patients. But truthfully, you were probably looking on WebMD several years ago being told that every ache and pain you had or cough or sneeze was cancer. So these tools are just a drastic improvement over what those websites used to offer. And at the end of the day, if you are more prepared, not only will it make your experience better, selfishly, it'll actually make our experience better as doctors. So you'll get better care. It'll be a better experience for everybody. And hopefully, what that means is that you will be less dependent on the health system and more in charge of your own care. So that's it. That's the episode of Second Opinions. I'm Dr. Nolan Fisher. I'll see you next week.